Hi doctors. A few weeks ago I noticed a bump on my nose, and at first I wasn't real concerned, but it's been here for a while and now I'm getting worried. Is there anything that can be done about the bump on my nose?
Sandra is here along with our good friend, dermatologist Dr. Ava Shamban. Welcome to you both.
Thank you.
Thank you.
So let's clear up all this confusion.
Is it a boil? Is it a pimple? The eternal question.
That is the question.
Is it a boil? Is it a pimple? Now, Sandra, you've had this on your nose for about 3 weeks, is that
Yes.
correct? Yes. And so what's happened is it doesn't look like a classic boil now. A classic boil is swollen and red and painful, and in fact can look very similar to Chevy Chase's paronychia that he was just talking about. And what's different from a boil to a pimple is that a boil is usually caused by a bacteria such as a staphylococcus or a streptococcus that you can pick up at the gym or at the market or any contaminated surface. So what's important about a boil is that if it's really tender and painful, you're running a fever, you've got a lot of redness, you want to go see Travis. Travis will give you his number. And because it can be an emergency situation. And that's another very important point, is that you do not want to manipulate a boil, because if you do, the infection goes deeper into the skin, and you can actually spread that infection into your skin, getting what we call a cellulitis, which is a skin infection, a potentially life-threatening situation. So what I'm going to do is I'm going to cleanse the surface with an antiseptic.
And one of the most underrated elements of this procedure, which is why when people do it at home, oh, I cleaned it, but they don't clean it the way it needs to be cleaned with professional grade products. So
then what I'm also going to do, as I mentioned the bacteria, is we're going to do a culture. And Dr. Orden has been kind enough to assist me. Okay, so close your eyes. Sandra doesn't like needles. So we're just going to prick the surface. Everybody hold your breath in the audience too. Yeah. You okay? Mm-hmm. And then, so this is the other reason, because if you start treating it without a culture, you don't really know what you're treating, what kind of bacteria, and you want to make sure that we don't have a resistant bacteria.
When are you going to squeeze it?
I'm going to, hold on, hold your water, here we go. Okay, so
and
now.
Getting back to the boil, a bigger boil, you'll automatically see a lot of purulent material come out. And that's why you said this isn't a classic boil, because again, you'll make that little nick and a lot of pus will come out to relieve that pressure, which Sandra doesn't have as much of.
So in this case, you're using your comedone extractor to clean it out, see what's in there. And
it's exactly right, because it's a petite boil. It's a small boil on the scale of boils.
Sandra, you doing okay?
I'm fine.
Sandra, you're
Sandra's
going to be cured in a second.
Yay.
So when you go to your doctor, your doctor will send this for culture, usually if there's concern about what the bacteria may be. And then the key is afterwards, you're putting on some antibiotic ointment, keeping it clean, letting that area heal up so it doesn't get infected, turn into cellulitis like you mentioned. Excellent work, Dr. Shamban. Thank you.
Exactly.
Very brave.
Thank you.
Sandra, thank you.